We're going.
Alright, welcome. My name is Benjamin Wood, and I represent the North Texas Institute for Major Depressive Disorder in the Clinical Division. My division is responsible for keeping clients of all, or helping clients of all ages overcome major depressive disorder in a multitude of different ways. Our clients are referred to us from various other agencies around the Dallas-Fort Worth area, and have already been screened by a licensed psychiatrist that have been diagnosed per the DSM-IV standards with major depressive disorder, or MDD, before they arrive at our facility. Although our clients have been referred to us with clinical diagnosis in hand, it is crucial that you, as an LCSW, licensed clinical social worker, be able to recognize the symptoms of MDD. In order to be clinically diagnosed with MDD, the client must note a depressed mood or affect, or loss of interest and pleasure in things they once derived interest and pleasure from over a 2-week period in order to be diagnosed per the DSM-IV standards. The client must at least acknowledge 4 of the following symptoms that have happened over those 2 weeks. So, the first symptom that you really want to worry about is the weight gain or loss. That's going to kind of give you an insight to their activity level and what they're doing and how they feel about themselves. Second one is problem sleeping. That's insomnia or hypersomnia. Increased or decreased activity levels. Fatigue or loss of energy. That's if they don't get out of bed, they have trouble getting out of bed and stuff like that. Problems thinking or making decisions. They don't feel as sharp as they once did, and they've had better cognitive functioning. Feeling guilty or worthlessness. And then of course with all depression, this is the big one that you want to avoid, are thoughts of death and suicide, and that's the instant red flag there. So, although it is important to note that all antidepressant medications must be prescribed through a medical doctor or licensed psychiatrist, as an LCSW, it is crucial for us to know that there are side effects and how those impact our treatment and how a client can manage those and be able to report those. So there are 3 major categories of antidepressants that I would like to go over with you today, and then 1 miscellaneous category that kind of umbrellas of the other ones that don't fall within these major 3. So the first one are MAOIs, or monoamine oxidase inhibitors. These are the oldest ones, have been out on the market for quite a while. You've got Marplan, Nardil, and Parnate. These aren't used really anymore because they have intense food interactions, almost lethal in some cases. So really once the other types, the newer types of antidepressants fail, this is kind of seen as a last resort. Still effective, but there are problems with the side effects. The next medications that I'd like to go over with you are the tricyclic antidepressants. This includes Trophanil, Trophanil PM, Elavil, Emetid, Indap, Amitril. These are all the same medications. Norpramine, Pertofran, Vivactol, which is a big one, and then Sermentil. These ones have been known to have devastating effects for clients on the cardiovascular system. So you want to be careful with clients that have history of heart disease in their family history, personally with heart disease, anything like that. Cardiovascular problems do arise. And then also, these are lethal in larger doses. A handful of these can kill someone. So what you really got to be careful with is those clients that are depressed and that have suicidal ideations, that they get these in small doses and you try to keep their information that these can kill them, and you really want to try to avoid that at all costs. Now, by far the most widely used and most effective antidepressant medication on the market today are your serotonin reuptake inhibitors, or SSRIs. This includes Prozac, Paxil, Zoloft, Luvox, Celexa, and Lexapro. These are a lot out on the market today, and they're pretty well known. And even though these are known as the most effective, they still do have side effects. And in most cases, it really has to do with one's libido, or with sexual drive or performance. They don't quite get as excited as they used to, and things of that kind of nature. Also, you got to be careful when these guys get off of their antidepressant medications, because they have a chance to go into shock or withdrawal and experience flu-like symptoms. So you have to really wean them off of them to kind of avoid that. Now there's also 3 of these guys that I also kind of want to highlight some other effects for. Prozac, they tend to be weight positive, so you'll gain 5-10 pounds, not major, but still enough that a client will notice and maybe bring something up to you. Paxil is the one you really have to worry about as far as weight gain. You can gain as much as 20-30 pounds. I mean, you're packing on 10 pounds a month, and as soon as you know it, the client's unrecognizable because of their extreme weight gain. And the last is Zoloft. It curbs impulsive behaviors, which is, can be good, and there's a mild weight gain. So you got to also note that. Amongst, even with these in those 3 categories previously mentioned, there are some that don't fall within the umbrellas or scope of those 3. This is Deseril, Wellbutrin, and Zyban, which actually is also a smoking cessation medication. Kind of gives you a weird sensation when you smoke it while on this medication. You've got Effexor, Surzone, Cymbalta, and Prestique as well. These are all pretty new, and they all kind of work to affect the neurotransmitters in the brain. So, here at the MDD Institute, we utilize Aaron Beck's cognitive behavioral intervention known as CBT. This is one of the most effective and empirically supported therapeutic techniques. It's predicated on the notion that really automatic thoughts or beliefs or cognitions precipitate depression. So basically, how one's thoughts and beliefs impact one's behaviors, and how it kind of leads to how one feels and emotes, and how it kind of leads into depression. So the goal for this technique is to alter those maladaptive or negative thoughts and convert them into more constructive thoughts and beliefs. So you kind of want to interpret the way they're looking at things. This is divided into 7 steps that we use here at the North Texas MDD Institute. The first step is selling your cognitive rationale for your client's problems. You want to sell them on the ideas and the ideology behind CBT. Second is self-monitoring. You want to kind of keep a journal and have them record their thoughts, feelings, and behaviors, and kind of helping them understand the interconnectedness of them all. Third step is behavioral activation. You want them to really get out and do things, do really positive reinforcing activities that make them feel good about themselves. The fourth step is identifying those beliefs, which we will kind of go into later on. Evaluating those beliefs. This involves challenging their beliefs, having them develop other ways to look at it. The sixth step is testing more generalized assumptions. So you're really trying to get a broader theory of how they interpret things and kind of challenge that. You really want to restructure the way they look, reframe the way they look at things. And then of course the 7th stage and the final stage is termination, relapse prevention. So you really want to keep them how to recognize a relapse, how to prevent that, and then what to do if something like that happens. So for the sake of time today, I'm going to be having 3 sessions where we cover the first 5 steps up through evaluating beliefs, and provide you with a possible approach through my demonstrations. So now we've covered our symptoms, medications, and our approach, the CBT approach. Let me give you a background of today's client. Jeff is a 50-year-old white male who's been experiencing depressive symptoms over the past month. This is because, he was referred to us by a psychiatrist after he self-referred himself to that psychiatrist. He's been feeling blue, quote-unquote, since his wife told him that she wanted a divorce. He tried to work past these feelings, but the symptoms have proven too much for him. So he feels tired all the time, doesn't want to do anything, never wants to get out of bed, feels worthless now that he knows his wife wants to leave him, and stays up all night thinking about what he'll do after the divorce. So, in our first session today, acting in session 1, we're going to cover the first and second steps. So the first step we're going to be covering is selling your rationale behind CBT. We want to establish a link with the client between the way they think and the way they emote, and inform them of what will come of this procedure, and how we work collaboratively to really work as a team to kind of test their rationale, test their beliefs, to get them thinking in more constructive and positive ways. The next step is to explain the concept of self-monitoring, so they keep a record of their thoughts, feelings, and behaviors of those days, in hopes of having homework between sessions to kind of internalize this change that we kind of established through these sessions, and kind of help them get momentum from week to week, instead of having to jump from week to week and go back and forth. And so we have a momentum going into each session. So with that being said, our ultimate goal is to show them how with this self-monitoring, how their feelings, actions, and behaviors and emotions are all intertwined, and how they all impact each other. So that being said, we were going to dive right into our sessions here.